Okay, hello everybody. Good morning. Let's get started. So my name is Ming Wen. I'm the Dean of the Faculty of Social Sciences at Hong Kong U. I am extremely pleased to welcome Dr. Megan Ranney to visit us, share with us her perspectives as a distinguished speaker. And we have an hour for this event, so this is what we're going to do. I'm going to provide a brief introduction for our speaker today, and then followed by a dialogue moderated by Professor Paul Yip, who is a chair professor in social work and social administration, and also associate dean of knowledge exchange and development for the faculty. Okay, so Dr. Megan L. Ranney is an emergency physician, researcher, and a national advocate for innovative approaches to public health. In July 2023, she joined Yale University as Dean of the Yale School of Public Health, where she is also the CEA Winslow Professor of Public Health. Her research focuses on developing, testing, and disseminating digital health interventions to prevent violence and related behavioral health problems, and on COVID-related risk reduction. Her impressive background includes holding various national leadership positions. Notably, she co-founded Get Us PPE, an organization dedicated to providing personal protective equipment during the COVID-19 pandemic. Furthermore, she serves as a senior strategic advisor to AFFIRM, a firm, at the Aspen Institute, where she focuses on utilizing a nonpartisan public health approach to combat gun violence. In the past, Dr. Ranney served as the Warren Alpert Endowed Professor of Emergency Medicine and held the roles of Deputy Dean of the School of Public Health and Founding Director of the Brown Lifespan Center for Digital Health at Brown University. Recognized for her expertise and achievements, she has been elected as a member of the prestigious National Academy of Medicine and is a fellow of the Aspen Health Innovators Fellowship. Dr. Ranney is also a member of the Aspen Global Leadership Network. Dr. Ranney is a highly accomplished individual, you probably have realized by now, who has achieved impressive academic milestones throughout her education. She graduated summa cum laude from Harvard University. This means that the highest academic distinction, earning a bachelor's degree in the history of science. So majoring in non-STEM has hope. Subsequently, she pursued her medical doctorate at Columbia University, where she graduated with distinction as a member of the prestigious Alpha Omega Alpha Honor Society. And building upon her medical background, she obtained a master's degree in public health from Brown University. And with that, please, Professor Paul Yip and Dr. Megan Ranney to come to sit here.
Good morning. I think if our dean is going to continue to this, I think we can finish it in an hour just by introducing me. But indeed, it's a great pleasure to welcome you. I think because we understand that you are on some sort of official tours to Hong Kong, and then we just grabbed this opportunity to bring you to Hong Kong. To Hong Kong U, and then you can see we have a group of very young, budding, I think, scientists, I think, who would like to learn more from you. But before that, could you just tell us a bit more about yourself, apart from this very elaborate academic career?
Thank you. Well, it is an absolute joy and honor to be here at Hong Kong U. I'm deeply appreciative of the invitation, Dr. Yip and Dean Wen. Thank you. I really appreciate it. I'm thrilled to be here. So a little bit more about myself. As Ming Wen mentioned, I am an emergency physician by training and did additional public health training and postdoctoral training in injury prevention. So applying the science of public health to the prevention of injuries in general, car crashes, drownings, poisonings, suicide, and also violence. I started my career in public health, actually working on the HIV/AIDS epidemic where gender-based violence is a big part of the transmission of HIV and AIDS. Another big factor, of course, is stigma. That created my interest in thinking about how we can change patterns of violence as a way initially of preventing transmission of HIV/AIDS, and then extended into other forms of violence. As many of you know, in the United States, we not only have high rates of homicide and suicide, but we also, unfortunately, have the highest rate of death from gun violence in the developed world. And over the course of my career as an emergency physician, after taking care of many, many victims of gun violence, started to try to apply those same public health tools that many of you are working on here at the Faculty of Social Science to the problem of gun violence in the United States. I've been quite privileged to go back and forth between doing research, doing advocacy on a national scale, in particular, getting funding for and attention to the issue of gun violence in the United States, and then also getting to be part of academic leadership. We talked a little bit yesterday about the joys of being a dean, the joys of getting to mentor the next generation of scientists, and to create paths that make it possible for faculty as well as students to do transformative work and to translate that work out into the real world. So that's a little bit about my path, and I'm sure we'll dive in a little more. But it was when you reached out, I said, oh, it's perfect, because I've actually known of your work. And so I'm really excited to have this conversation when we think about the intersection between violence and mental health, although, of course, having mental illness is not a determinant of, it's not a one-to-one correlation between mental illness and violence. Certainly plays a part, and it's certainly a consequence of exposure to violence. So very excited to chat with you today.
Well, I think you have mentioned about the gun controls, right? I mean, as we know, whether it is a Democratic the government or Republican, you still cannot control the gun control.
Right.
What are the barriers now? I mean, something is so obvious that it is a very fatal means of killing others or killing themselves.
Yeah.
But what are the problems?
The barriers. Yeah, and so just to kind of emphasize, because I know you don't have a lot of exposure to gun violence here in Hong Kong, quite luckily, but for suicide, more than half of the suicide deaths in our country are by firearm. And a suicide attempt with a firearm is 90% likely to be fatal. So I never have a chance to save them, right? They almost always die before they can even make their way to the doors of an emergency department. And then, of course, firearm homicide is much more likely to be fatal than other types of assault. So there's a few things that serve as barriers in the United States. The first is that it's honestly, firearm ownership is part of our heritage as a country. It's written into our Constitution. It's the Second Amendment. Number 2 on the amendments, right? First was free speech, and the second was the right to own a firearm. So it is baked into the fabric of the United States. Any of you that have watched Western movies know that there's this mythology about cowboys, it was men, generally men, and firearm ownership and shoot 'em up, kind of Wild West corral, that's part of our sense of what it is to be an American. And then there's also a belief of individuality and a sense that you can't rely on others to keep you or your family safe. And the firearm industry has really preyed on that fear over the last 20 or 30 years and has made people believe that the only way to keep their family safe is by owning a gun. As a result, we've seen huge increases, not in the number of households that have guns. That's stayed pretty steady across time. Around 40% of American households have a firearm. But rather, we've seen increases in the number of guns owned per person and in the lethality or the firepower of the guns that are owned. So there's been a real kind of shift in the social norms around firearm ownership. Relatedly, A, people think they need it to protect themselves, but B, the whole kind of part of firearm ownership being a privilege as well as a right, the privilege part, the idea of this being something that you take seriously, has kind of disappeared a little bit. And so a lot of people buy guns thinking that will keep them safe without committing to doing training, without committing to safe storage, without thinking about how to minimize the risk of harm for themselves and their family. And so that's been kind of part of the problem as well, is that partly because of the individualistic culture, partly because of advertising, on a normative level, people have lost the sense of this being something that they have to take seriously, like you would driving a car or, flying an airplane or driving a motorcycle. That sense of that you need training has kind of been lost.
Good. Now, when we during the conversation, I mean, if you do have any question, please write it down, and then I think we will reserve about 10 to 15 minutes of the time, and then that you can ask question to Dr. Ranney. Is okay? Okay. Now, as you are the dean of the School of Public Health of one of the esteemed universities, I think, in your opinion, what are the immediate and largest public health threats, I think, in US and also globally as well?
Oh, it's a great question. So I think one of the largest public health threats is actually the lack of trust in public health and the healthcare system. We've seen it. I know that you've experienced it here in Hong Kong with lack of trust in the vaccines, the COVID vaccines as they were distributed. And in the US, it's really become in its own way an epidemic around COVID vaccines, around other vaccinations. We're seeing childhood vaccination rates drop. We're seeing increasing spread of misinformation and increasing distrust of scientists and physicians. To me, that's a huge public health challenge, because when we think about how to change health, there's certainly policies, but it's also behavior change, right? It's thinking about, again, kind of norms, attitudes, self-efficacy. And if people don't trust the advice that they're getting, they're then going to have unhealthy behaviors. So that's, I think, the biggest one. Second is climate and health. And I know, again, it's something that you're experiencing here. I was just reading this morning in the newspaper about school closures across North Africa and the Middle East because of heat waves. In the US, we're seeing overwhelm of emergency departments, increasing rates of asthma, heart attacks, strokes, because of heat emergencies, because of wildfire smoke, et cetera. And so the impact of the environment on health is, I think, the second huge, almost existential public health threat that's facing us. And then the third, there are two more that I would list. The third to me is healthcare cost and access. Again, something that I know that you're struggling with here in Hong Kong as well. As our population ages, we're seeing increasing utilization of healthcare services without an increase in workforce and without really space for folks to go and get taken care of. We're seeing costs skyrocket because of new technologies and pharmaceuticals. In the US, 20% of Americans have debt because of their medical care. 1 in 5 Americans holds medical debt. And quality of care is going down. So I think it's an international problem, but particularly in the US. And then the final huge public health threat, of course, is mental health and related problems, drug use, violence, that all kind of social syndemics that result from lack of community and hopelessness.
Well, when you mentioned about the cost and accessibility, as I understand, I think the US, I think, still spend high percentage of your GDP, but with lower or relatively inferior performances.
Correct.
So what are the problems? See, in Hong Kong, I think we are relatively better. We do not spend so much in the GDP, but our life expectancy, and we still have a more universal accessibility of this medical care.
Yeah.
So what are the things that we can learn from one another? I mean, I'm sure you have the emergency physician. I think you know what are the problems, right? Can you give any insight?
Absolutely. So I think, the fact we spend almost 18% of our GDP on healthcare, and yet, as you said, our life expectancy, like our violence rate, is our life expectancy is among the lowest of developed countries. The reasons for that are a few, and then I can talk about why our costs are so high. But we see very high rates of violence, suicide, and opioid overdose. Those all drive life expectancy down. And we also have high rates of maternal and neonatal mortality. So moms and babies are dying at much higher rates than in other developed countries. A lot of it comes back to a lack of a functioning public health system. So we see huge disparities in life expectancy between states. and even between counties within states, based partly on the policies that are in place. So do people have Medicaid, which is our insurance for kind of low-income Americans? States that didn't expand Medicaid access have higher maternal mortality because people can't afford to go and get checked and get prenatal care, and they're worried about bills, right? Is there a public health system that sets up a community, kind of a sense of community and a structure for those who are down on their luck? If there's not, then we see higher rates of opioid overdose because people start using substances and don't have access to addiction treatment. So it's deeply related to our lack of investment in the public health system. And then our costs, a lot of the American healthcare system is for profit. And even the parts of our system that are not for profit, people still make a lot of money. Our CEOs of pharmaceutical companies and insurance companies make quite a bit. And then of course we do have the aging population, but you share the same problem. And yet, as you said, your life expectancy is much greater. The last thing that hasn't been, that people are kind of dancing around the edges on, is that sense of social connection and community. Our Surgeon General, Vivek Murthy, who's a Yale graduate, called out last year, or almost 2 years ago now, about the epidemic of loneliness in the United States and the clear connection between loneliness and adverse health outcomes, mental illness, early death, et cetera. The US has become a very atomized, again, an individualized country, and partly related to social media, partly related to political problems, but that absolutely has an impact on folks' healthy years as well as their overall life expectancy.
I think this loneliness is also not only happening in US, in UK, I think in Hong Kong as well.
Yeah.
But I'd like to turn to when you mentioned about the lack of trust.
Yeah.
I think that is also a common problem. I think not only in US, I think in other parts of the world as well. How can we cultivate, I mean, this trust between the government and the people?
I wish I knew. I have hypotheses that have not been proven yet. And I will say to the students in the room, again, to me, this is one of the biggest things that you can take on for your career. It's talking about loneliness and thinking about how we create trust. So we have some data suggesting that trust is deeply related to who is messaging about health information and health behaviors. So engaging community messengers, engaging people who look like you, who talk in the same language that you do, who have the same cultural beliefs that you do, that's a great way to increase trust. A second thing that has been shown to increase trust is just showing up and taking care of people's basic needs. One of my friends, physician and public health practitioner named Celine Gounder, just did a whole podcast series on smallpox vaccination efforts that were led by the WHO and that eradicated smallpox, and talking about how in order to get people to accept the smallpox vaccination, first, you had to make sure people had food to eat and had clothes to wear, because why would they think about a vaccine if they were worried that their kids were starving? And so that's the second part of trust, is I actually think we're failing to provide those basic needs for many. And then the third is, of course, social media. And I don't have a great answer for that. But social media allows bad information to spread really quickly, and it makes it very difficult to verify whether what you're reading is true or not. And there is unfortunately a lot of money behind spreading bad information. I was talking to my children and my husband this morning. They're 12 hours different. And my husband was sharing with me an article that a friend of his sent him. And he was telling me all the different places he went to try to figure out if that article was true or not. Now, my husband is intelligent and had the time to go and look at those different sources. Most people, and probably most of us, don't triple check the veracity of an article before we share it. And I think that leads to lack of trust too, because you are seeing people that you think you trust sharing things that turn out to not be true. And then you say, well, can I trust them the next time? Is their information still going to be real and trustworthy? So that aspect of social media is, I think, a huge, huge challenge for us that no one has answers to right now.
I think during the COVID in Hong Kong, I think we also experienced a lack of trust about the vaccine. I think during the initial stage, I think when the government tried to encourage the people to take the vaccine, and then also I think there are so many things because of this trust. I think it has become a barrier. So in COVID-19, I'm not sure US is doing any much better than us, but we are also trying to have a review. I think of what can we learn. I mean, from each other. I mean, just in case if the next epidemic comes, how can we be better prepared? From your experiences, right? I mean, from what you know, I think in US or globally, what are the good practices or what are the not so good practices we should not do or we should do? I think when we prepare for the next the
next pandemic. Yeah. I mean, I think it's inevitable. And I think you in Hong Kong did much better, particularly early in the pandemic, than we did in the United States, partly because of your experience with SARS. And folks had already been through this and knew how important surveillance, masking, et cetera, were. In the US, just like with the gun problem, we're very individualistic. And so we were not set up to believe kind of what was happening. I think, there were a lot of problems. I can talk about problems for a very long time, particularly in the US. The disease was politicized very, very quickly in the United States. I was actually watching this morning a video of our then President Trump exactly 4 years ago, talking about how this was a made-up virus and that it was going to go away in 2 weeks. And that just set people up to think, well, then why are all these public health people telling me to stay home and telling me to take it seriously? So we had a lot of problems in the US, but I do think there were some good things. And I actually think Hong Kong led in many of those good things. So the development of new methods of surveillance, wastewater surveillance, for example, was huge, so influential in terms of our ability to track on a population level basis and to forecast where there were going to be hotspots. The advances in modeling and forecasting were tremendous. At the Yale School of Public Health, we have a whole group of public health modelers who work on infectious disease and policy, and they switched overnight to spend all their time on COVID modeling. I saw similar things here in Hong Kong amongst colleagues in other great academic centers across the world. And I thought that was just tremendous. We advanced the science of modeling so much, and that was really helpful in terms of predicting outbreaks. And then the development of the vaccines. I mean, it was amazing to think that we went from discovering this virus in December, January, right, finally sequencing it. Within a couple of weeks of sequencing the virus, they actually had initial prototypes of what would become the mRNA vaccines. It took us a bit to get them appropriately tested, but really a revolutionary and outstanding speed of development. And although the vaccines ended up not being as durable as we had hoped because of mutations in the virus, they're still really marvelous as you think about vaccines and vaccine efficacy. So I think there were some real wins. I wish that we had maintained more kind of transparent international collaboration. I think there were some wins early in the pandemic around international collaboration that have gotten kind of lost a little bit in the last year or so. I think, again, the trust issue and the communication, I think we could have done a lot better. And I think we've learned a lot about protecting the most vulnerable. I think, different countries responded differently for how to protect kids. And in the US, I was actually part of reopening our schools for elementary and middle school kids very early in the pandemic. By September of 2020, we had reopened schools in Rhode Island and in Connecticut, the 2 states where I live and work. But there were many places that didn't. And I think the negative consequences of that, both we're seeing them among kids, but it's also, again, elevated the mistrust among parents. So I think there were definitely some lessons learned in that way as well.
I think especially for the school closure, I think in Hong Kong, we do suffer quite a bit. I mean, for the past 2.5 years of the COVID, I mean, because of the disruption,
Yeah.
I think of the schools, now we need to some long COVID on the mental health,
Yeah.
and especially on the vulnerable group. I mean, they have difficulty to catch up with the curriculum, and then subsequently, I think the mental health also being affected.
Well, and it's also, you think about, I do have a little bit of debate with people sometimes because I'm sure it was the same here. The amount of stress that we were all under as adults trickled down to our kids, right? My children were 8 and 11 when COVID started. And they absolutely felt my own fear of the virus. I mean, I was working in the ER, but also they saw the world change overnight. And so even without school closures, we know that kids who are living in families that are stressed out have worse school outcomes. So, again, we got our kids back to school pretty early in Rhode Island, and nonetheless, we're seeing the same mental health problems, the same drops in learning, gaps in learning compared to pre-pandemic. And I have to think that part of it is because of the overarching anxiety and fear and grief that we were all living under at that time. So,
well, we also understand that you are an innovator. I mean, especially in promoting this digital health, right? I think as we know, the technology is changing very fast, especially with the rise of the AI. I mean, they are talking about whether AI can look after the patients, I mean, without the human beings. And how do you see being integrated into the public health and the healthcare system now? What is your vision, and how would that affect the accessibility, the equity? With this new innovation, it can bridge the gap, I mean, especially for those people who are more vulnerable?
Yeah. I think my vision is probably pretty similar to yours, which is that in the best of all possible worlds, digital health is an extender of other humans. We don't have enough workforce to care for folks, to provide health advice, to provide mental health counseling, or to track disease spread on a handwritten or kind of one-on-one basis. And so I think in the best possible world, technology helps to facilitate all of those parts of public health, data acquisition, analysis, communication around health behavior change, support systems, some basic mental health counseling, and connecting people to physical in-person services when needed, right? It can serve along that whole spectrum. But there are worries about accessibility. I actually don't know here in Hong Kong what smartphone ownership, laptop ownership, and broadband access is like. But in the United States, everyone has a smartphone, regardless of socioeconomic status. But we do see big differences in in people who own a laptop and people who have good Wi-Fi. Lower socioeconomic status, rural, Black or Hispanic groups have less access to Wi-Fi. So if we don't develop digital health thoughtfully for the phone in a way that minimizes Wi-Fi use, we can amplify those health disparities that are such a problem already in the US. But you're doing some really neat work with digital health in a way that hopefully minimizes disparities.
I think we have a group of scientists here. They develop some checkbox. I think they like to provide this around the clock support, I think, for the people. But we still have to further enhance the performances and the accuracies of this engagement. Now turning back to the mental health, I mean, as you are very passionate about, we all know that no health without mental health, and how is your mental health?
My own? Today it's good because I slept last night. I will say my first day here, right? The jet lag, lack of sleep affects you. I was like, oh, a little off, but today my own is good. I have some hope.
And it is because I think I read the news just yesterday, and then there's there's a report from the United Nations. I mean, Hong Kong is not doing so well. We rank number 82 or something like that, and US is around 60 or something like that. But the young people are still not very good. So it seems that all the young people here, right? So it seems that I think they have experienced something. I think the life trajectory, the hopefulness, it seems that it is not as good as
Ours.
You know?
Yeah.
I'm not sure we're same
We're
cohort,
close.
but what I'm trying to say, how can we really help? I mean, how do you see how can we really promote this sort of this mental wellness?
I think it's a great question. So to me, I think a big part of it is hope and agency. I'll frequently say, again, I don't blame youth for feeling anxious and depressed. You look around the world and you're like, wow, we just were shut down for COVID. There's probably going to be another pandemic. We have climate change kind of breathing down our necks. We have some political unrest and instability across the globe. I think it's normal and appropriate to feel a little bit anxious and worried. I think we've also, again, lost that sense of community, which matters so much, either in person or virtual. Having people who you can share your feelings with and who you know are going to support you is so critical. And there's so many studies showing how much less youth are today to have those kind of in-person contacts, how much more isolated folks are. So I think that's part of it. And then I think creating agency. The biggest thing that I see amongst the youth that I work with is that they feel like nothing that they do will make a difference. I will fight against that kind of misconception. I think that the things that youth can do today makes a huge difference. And if you don't take action, if you do not contribute to science, well, then hope is lost, right? We can determine our future to be a negative one by not acting. The lack of a choice is in itself a choice. Alternatively, we can enhance our own mental health as well as the health of the community by joining together, creating community for good, taking action together to try to create positive, healthy change that will, if you talk about cognitive behavioral therapy, right, it's changing the way you think, it's also changing the way you act. And I think acting to make the world a better place is a huge driver of mental well-being. So to me, it's that combination of realistic anxiety, not being connected, and then lack of agency. So this is where I think universities can make a very big difference in terms of giving you skills that you can use to go and create change.
I think this mental health, I mean, there's not only particular preference among so-called the vulnerable group people, but some people who are high achiever. I mean, they are also having a lot of stress. Now you're from Harvard, from Columbia, from Yale, and you're not only from there, you're always the first. So have you ever have any failure, or have you ever be the second or something like that? No?
I'm generally not first. I'm generally somewhere in the top 10%. So yes, I mean, so I think part of my Ben, who's here with me from Yale, knows this. My drive has never been to be the first. It's to do the most good in the world. And so my career path, although when Ming reads it, it sounds very straightforward, it actually was very topsy-turvy when at the moment. The decision when I graduated from college, I decided to go and be a Peace Corps volunteer because I had no idea what I wanted to do in the world. I drove cross country with my boyfriend. I worked as a temp for 6 months and then decided to apply to Peace Corps because I didn't know what else to do. Was in Peace Corps, which is an American kind of service program where they put Americans in other countries to help kind of with development. And that was a bit of a wake-up call for me, but was also unbelievably difficult. I was living in French-speaking West Africa. I was the only American in my village. There was no water or electricity. And I didn't know the first thing about the thing that I had been put there to do. I was supposed to be working on water and sanitation, good public health topic. I had a degree in the history of science. I didn't know anything about water and sanitation. It was so depressing and frustrating. And then I found kind of HIV as this emerging issue in Peace Corps, and it really kind of transformed my life. I would say I went through similar challenges at Brown, where I went into emergency medicine, which I love. We talked about, I love being an ER doctor, but also saw this possibility for making the world better. And that's what drove me to go and get my master's and to do a postdoc. But there was a lot of uncertainty as to whether I could do it or not. I was having babies at that time, although I have a wonderful husband. He was not super into childcare. And I thought, yeah, I actually thought about leaving academia altogether because I didn't know if I could succeed, if I could actually do what I wanted. So there have been a lot of points where I faced failure or near failure, and then got lucky to have a mentor or a problem present itself that motivated me. I think part of it is just life is not, it is absolutely not straightforward, and it is not full of successes. But over time, the failures get kind of not talked about or erased. So I appreciate the question. I've had grants that didn't get reviewed or discussed. I've had there are plenty of stuff out there. It just doesn't make it into the bio. So maybe I should add that in. I'll have like a little paragraph at the bottom of like a list of the failures too.
But one thing I'm very impressed by Ranney is that I think she insists, I think, to spend some time to be a practicing ER physician.
Yeah.
I think she still like to not disconnected, I mean, with the front line and the middle real people. So I think what this public health is all about is about the people, how to make the people better. And then we cannot just sit in the office, right? And then you have to get your hand dirty, and especially in ER.
I mean, ER, demography, any of these things, it's about going out and actually meeting people. I think it's easy and to sit in our offices. And honestly, I spend most of my life right now sitting in an office, for better or for worse, or maybe walking around campus. But it is important for us to actually have those connections and conversations with family, with communities, with the organizations that we care about, because it's very easy to miss the big picture. History is littered with stories of academics and policymakers who think they know what will be best for a community, but they miss something big because they never actually took the time to listen and to get to know the community that they were trying to help. And then they pass laws or put programs in place that were bound to fail. And they could have known that had they just spent a little bit of time up front getting to know people ahead of time. So I'm a big fan.
We salute you, your commitments.
Thank you.
Now, and then as you see, I mean, what do you see the biggest topic to take on through this international collaboration? I'm sure one of your purposes of your tour, I mean, you're a great ambassador of Yale University, of the US, I mean, coming to Hong Kong, I mean, try to promote this exchange, right? But this geopolitics, I mean, when you look at now and a few years ago, I think the world has been a very different place. I mean, like even the US and China relationship, even our Hong Kong U relationship with the US institution has been not so smooth. I mean, it's been, especially in the technology areas, right?
Yeah.
How do you see, I mean, how can we promote some good practices really to cultivate the mutual respect, understanding, and then to promote the well-being of the mankind?
Yeah. So I think I will say I am not a politician. I am not, so I'm not going to opine too much on geopolitics, other than to say, yes, the world is so different. I mean, I think back to 1997, which was, of course, the year that kind of Hong Kong's transition. We had kind of in that year, we had peace accords in Ireland. Israel was stable, and you could travel from Israel to the West Bank to Gaza without any trouble. I mean, it was a different world 30 years ago. I think for me, it's actually part of the reason that I have stayed in academics rather than doing something else with my career, at least recently, leaving aside that moment when I almost left 15 years ago. But one of the reasons I've stayed in academics is that I think that we as academics can maintain those relationships and partnerships for the good of humanity in a way that might be difficult for politicians or businesses. And so I think that these kind of exchanges, both cultural but also intellectual, thinking together about the problems that we both face, helping to share ideas that have worked for one of us or for the other. Our cities are different, our cultures are a little bit different, but it's also a global world. We're not all that different when it comes down to it. And certainly humans are humans, and the vectors of disease transmission, whether infectious or non-infectious, are the same, are almost the same. So I think that these academic partnerships are key for the future. I think we probably are in for a rocky few years ahead, but we've been through this before. I mean, this is not the first time in history that we've had rocky geopolitics. I was not alive during the McCarthy era in the United States, but goodness knows that there were a lot of problems with international collaboration in the 40s and 50s in the US. There were brave academics that kept collaborating regardless, because we knew it was important to have those partnerships. And so I think there are really great ways for us to maintain those. I also think student exchange matters deeply. Almost half of our students at the Yale School of Public Health are international. And of those, the majority are actually from mainland China. And I don't see that, knock on wood, I don't see that changing. So to me, it's, I think that it's also kind of making sure that we have that space for young people to have exchanges. We were talking about James Chow and his, I'm going to mess up the name, but the China US Student Exchange Foundation. I think it's a great example of a way that we can maintain relationships. And some of you might come and meet someone and start working with someone who, 20 years from now ends up being a colleague of yours, and you may do world-changing research together because of some sort of a cultural exchange, when you're in your 20s. So I think to me that's the way forward. But again, I'm not a politician, so I don't know.
I'm sure you're doing much better than the politician.
Oh.
But one thing I cannot help to ask, what happened in November? I mean, so how does the election, I think, will affect, your work and then the world and then and everyone. So do you have any?
I wish I had a crystal ball. Most Americans are losing a little bit of sleep about our upcoming presidential election and what it will mean both for our country, but also for our relationships with other countries around the world. We're still quite a ways out from the election, so I think it's still a bit of a toss-up what will happen. I have to believe that American institutions will prevail regardless of how the election goes. And no matter what, places like Yale will survive. Our motto, and I don't know what yours is at Hong Kong U, but our motto at Yale is Lux et Veritas, so light and truth. We've existed for over 300 years, regardless of political administration, regardless of whether science was getting funded, regardless of, the Civil War or World War I or World War II, and we still did good research and trained great students. We will keep doing that no matter who is the president of our country. Might it change a little bit? Might there be more federal funding for grants or less federal funding for grants? Maybe. Will visas be easier to get or tougher to get? Maybe. But I think that our core function stays the same. And over time, things will change again. I mean, that's the joy of having studied history of science as an undergraduate, is that you see how the world kind of goes in waves, and this too shall pass.
I'm sure the president goes, the Yale's still remain, right? I mean, it's like Hong Kong U.
Yeah.
The Hong Kong U, I think we still pursue the truth and the knowledge always. Right? I think so. Now, may I open the floor, I think, to the audience? I think, do you have any question? I think if you just press on the mic, say who you are, and then I'm sure Dr. Ranney will be happy to respond to your question.
Don't be shy. Yay, good. Thank you for being first.
Oh, thank you for sharing with us your thoughts. So Dr. Ranney, I have a question regarding the loneliness problem you raised. I think it's a fascinating observation that we observe an increasing prevalence of loneliness in the population. So because I'm a sociologist, so I'm just wondering to what extent the increasing prevalence of loneliness can be attributed to some demographic changes. For example, declining fertility rate, increasing divorce rate, and also the one-child
Policy. Yeah.
China. So both me and my husband, we are the only child in our family, and now we only have one boy. So we have shrinking family size. So that means we have fewer family members to be supportive. So I'm just wondering to what extent that demographic changes can explain the increasing.
Yeah, it's a great question. I think it's demographic changes. I also think it's migration. And I don't know here, and I'll look to you as the expert, but I don't know kind of here what the trends are in migration, but in the United States, many fewer people end up living near extended family. So, and if I go back to my experience in West Africa, nobody left their village. Then they lived in these big compounds with brothers, sisters, cousins, grandparents all together, for better or for worse. I mean, there are sometimes problems with that, right? But there's been an increasing move to urbanization and people not living close to their family of origin. And I think that plays a role as well. There's also been a decline in community organizations. Again, I don't know and I'll look to you as sociologists. I don't know Hong Kong's political climate as well as I do the United States, but we have a lot more division amongst Americans along political lines. And so many organizations that used to, like, for example, the Rotary or bowling leagues that used to exist across political boundaries have faded away. People don't have time to be part of them. They don't want to spend time with people that have different political views than they do. And so that kind of atomization of groups is a big part. And I think there's pretty convincing data, it's not 100%, but it's pretty convincing that the rise of social media has played a role in loneliness, in the spread of loneliness as well. I don't know about you, but I'll say, my children spend a lot of time on screens rather than out in the neighborhood playing with other kids. There are some good studies showing that how you use social media makes a difference in whether it causes loneliness and mental health problems. If you use it for connection, for organizing activities, it can enhance your well-being. But if you're just passively consuming it solo, it can actually make you feel more lonely, anxious, depressed. TikTok, yeah, it's a great example. I mean, how many of us have lost hours just scrolling? I mean, that right? And there's nothing wrong with you for the fact that happens. It's how TikTok is designed, but that enhances loneliness. That's time that you would have spent 10 years ago, talking to a friend or out at a coffee shop, right? Even if you're sitting at a coffee shop reading a book, you're still interacting with other humans. So I think that really is a big factor in our loneliness epidemic as well. I mean, as with anything in health, it's never a single cause, right? It's always multifactorial, which is part of the reason that it's so important for us to work across disciplines to help both describe the problems, but also to create solutions together.
Just a very quick question following up Dodo's comments.
Thank you, Dean Wen.
As a doctor,
Yeah.
Do you think there are physiological differences interacting with people virtually versus interacting with in person?
Oh, that's an interesting question. I actually don't know if anyone has studied that.
Great, NIH topic.
That is a great question. Whether, the heart rate variability, cortisol levels are different. I would suspect that it differs partly based off of, again, how you're interacting. Are you just observing versus are you actually exchanging kind of information and conversation? But that would be a great study. It may be out there. I just don't know.
Just from a social perspective,
Yeah.
one thing is that you cannot physically touch that person.
Yeah.
Right. And Zoom meetings are different than in-person meetings. One thing I noticed is that we cannot simultaneously talk.
Yeah.
But that can be a technology issue.
That-
I think it's nice to talk out.
Well, and I don't know how much this has happened to you, but I find, there are people that I only ever Zoomed with. I had only met over Zoom. I finally met them in person and I didn't even recognize them because partly it's the 2D versus 4D, but also, you're on Zoom and you're looking at yourself half the time, even when you try not to. So
Absolutely right.
it's very kind of self-referential. Yeah, it's a great question. Yeah, in the back and yeah. And then
Thank you. Thanks for a fascinating conversation. I mean, it's just wonderful to be here today. My question is about abortion rights. Since the Supreme Court in the US overturned Roe and Wade, right? I'm just wondering what's happening to access to abortion and how women in those states which are very sort of religious.
yeah.
I mean, is it sort of worse outcomes for them? Mortality rate for mothers have gone up and that sort of thing. I mean, I'm just so concerned about that because I did a job for the UN in Papua New Guinea. So my job was to, do a study as to whether Papua New Guinea has improved its human rights record 30 years after independence from Australia. So it's fascinating, I sort of dug up all the statistics, went to all the different ministries. And one of the things was that for women, I mean, sort of death at childbirth and all that had gone worse, So I'm just thinking Roe and Wade in the US, what implication has it got? Thank you.
It's a great question. Data, of course, our vital statistic data and hospital data is always delayed. So we're just starting to see data from the states that put in place almost complete abortion restrictions after the overturn of Roe v. Wade. Preliminary data is suggesting that there are obviously fewer abortions, more unplanned births, more premature births, early low birth weight babies, and possibly higher rates of maternal mortality. We're also seeing that there are fewer obstetricians and gynecologists who are willing to work in states with abortion restrictions. We already have huge segments, and I don't remember offhand the numbers, but it's in the tens of millions of women who live in maternal care deserts, so that there's no access to actually good quality prenatal or kind of delivery or postnatal care. And that's worsening because people don't want to work in a state where they can't do what's right for a patient. And then to me, as an emergency physician, one of the things that's most disturbing is what is mostly anecdotal data right now, but there's been some collation of data on individual community levels showing that poor outcomes from obstetric emergencies. So often when I take care of a woman who is pregnant and has an emergency, often an induced abortion, whether medical or surgical, is the right treatment to save her life. And physicians are not being allowed to provide that treatment in many states right now, resulting in higher rates of ruptured ectopic pregnancies, higher rates of uterine infection because of early rupture of membranes, hysterectomies, et cetera. I could go on. So we're starting to document the health effects. In parallel, there are a lot of folks across the United States that are working to try to maintain some access, particularly to medication abortion for women who are living in those states. There's a big push right now for telehealth provision of the medications that induce medical abortion. There are threats from some attorneys general. So it's very complicated, but it is a huge potential health issue. And again, looking where we already have some of the world's highest, amongst developed countries, the highest maternal mortality and neonatal mortality rates. it is only going to worsen. And again, preliminary data suggests that we are indeed seeing worsening outcomes in those states with abortion restrictions. The good news there is that voters are recognizing the fact that this is not okay. And in states like Kansas and Ohio are voting against, when they're given the option, they're voting against those very restrictive abortion laws. So I'm hopeful that things will sort themselves out over the next couple of years. But for now, unfortunately, women and families are really being caught in the result of this misguided policy change. So.
It's
I have a question. I have two questions, in fact. I'm a postdoc from a
Right.
department. My research interest is about environmental health. Recently, there is a popular word about exposome.
Exposome, yes.
I want to ask you about your opinion. How do you think about this word will impact public health development? The first question.
Yeah, okay.
And the second question, do you think how to promote multidisciplinary collaboration to struggle public health issues?
Yeah, so the exposome is, to me, one of the coolest concepts right now in public health. I am a huge fan of it. I think it's a great way to think holistically around all of the impacts on health, both social and physical, right? So for those who are not familiar, the idea of the exposome is the idea that you're exposed to climate, you're exposed to chemicals, you're exposed to maybe childhood experiences, social connections, stress, work. It really integrates both, again, that physical and psychosocial aspect of health. And then it attempts to track the effect of what you're exposed to on your physiological change. So there's a lot of genetic studies that are going on, as well as psychosocial and physical health outcomes. So I think it's great, really important, and we're actually doing a lot of work on it at the School of Public Health. Our Department of Environmental Health Science has really reoriented itself to be almost entirely about defining the exposome and looking at its effect on human health, and then most of all, looking at what we can do to change it. So I love it. Thank you for bringing that up. And then for multidisciplinary collaboration, I think, to me, and we have some public health experts in the room, I think it's essential because we both need to describe and understand what's happening, and we need to create actions that can then act on the problems. So those multidisciplinary collaborations, I think, are not just good, but needed. How do you create them? I think it's partly by holding convenings, bringing people together across different colleges within a university, international meetings that bring together people from different disciplines. And I think grant funding makes a big difference in terms of facilitating those collaborations as well. If there's money, it makes it much easier to do the work together rather than just doing it out of the good of our own hearts. So, but I would say, feel free to, I know, again, some of the folks in public health here, including Vivian, as well as the Dean of the School of Public Health here. And I'm sure that they would be enthusiastic about collaborating. So.
You'd like to ask a question?
This is fantastic. I have so many questions, but
You only allow the one, okay?
can I ask really two questions? Trust is an element of it. And there are problems that, because Papua New Guinea really brings this to the fore. So gender-based violence in this region, Western Pacific, Asia Pacific, based on UN methodology, some of the highest rates of gender-based violence. Papua New Guinea is top of the charts.
Wow.
And intimate partner violence is a huge, huge issue, which in a sense violates trust at its worst.
Yeah.
So, so the big question is, like, how do we actually address this? Because it's a really, distinct problem. The other trust, again, Papua New Guinea is where we see the highest level of vaccine hesitancy for COVID, but it's also reflected in vaccine hesitancy across all vaccinations. But I think what we've seen during the period of COVID, while the scientists have been fantastic in getting the modeling and the vaccine, what we see is a failure in so many countries of engaging different communities.
Yes.
Whether it's the vaccines or any other measures. So are we failing in our education and multidisciplinary work in terms of working with people who work on communications?
Yes. That's the short answer to that second. Yeah. Those are great questions. So for partner violence, again, that's kind of how I got into doing the work that I do, was around partner violence and sexual assault. One of the biggest drivers of decreasing rates of partner violence, so one of the best ways to prevent it, is women's economic empowerment. And so this is, again, where that interdisciplinary work is so essential. When we provide women with the ability to earn income so they can pay for their kids to go to school without having to depend on an abusive husband, so that they can leave. When we give them that economic agency, it has a huge impact on then kind of the rest of the cultural norms as well as societal policies. Laws obviously make a difference too, but I'll frequently, people always think that laws are the total solution. But if you pass a law and people aren't willing to enforce it, or people don't believe in it, right? It's better than no law, but it's not in and of itself sufficient for change. So for me, that women's economic empowerment, and then the sharing of stories, the narrative, the stories about kind of how people escape and why it's not tolerable, matter so much. That said, even in the US, partner violence remains a huge issue amongst teens as well as adults. And I think we have a long way to go, both in destigmatizing, talking about it, in providing safety at the moment of leaving, which is the time of highest risk, and in enabling people to live productive lives as often single parents, because people often stay because of their kids. In terms of the vaccine hesitancy, so I know American Samoa a bit better than Papua New Guinea, and we see similar problems of vaccine hesitancy there. After Robert Kennedy Jr. visited the island, right, we saw measles vaccination rates drop precipitously and had a huge measles outbreak. I think it's partly, when we think about trust, I think for islands like Papua New Guinea or American Samoa, in many ways, it's similar to the challenges we have with Black Americans in the United States, where there is a history of medical maltreatment and of experimentation without consent. And so that sets people up to be understandably mistrusting. They know that their ancestors were tested on or were treated poorly, were exposed to, radiation from Bikini Atoll. Name the problem. They know the history of what outside forces did to their community. It is understandable that they do not trust us, right? It is absolutely based in a real historical legacy that we have to acknowledge and confront. And I think the only way to do it is what you said, which is engaging community leaders who are trusted by that population. I will never be able to walk into American Samoa and say, oh, trust me, get a vaccine. They're going to look at me and go, it's another white woman from the United States who's telling me to do something. Why would I trust her? On the other hand, if I can have, an elder, either male or female, depending on the community that I'm working with, serve as a messenger. And if in parallel, I can prove that, again, going back to what we were talking about, prove that we're providing the basic needs of life to people, that they're not eating canned tuna, but we're actually committed to making sure that they can harvest and use kind of traditional farming methods and have fresh food, So you can think about ways that you can gain trust outside of just focusing on vaccines. To me, that's the path forwards. But it's a lot of work. I mean, it's a lot of work. And it's not the stuff that gets us attention. I will not get promoted or get my next job because I went and organized a bunch of women to share stories about trusting vaccines. well, I don't need to get promoted again, but so maybe for those of you, but like, it's old habits die hard. But you know, you will get promoted if you come up with some brand new theory and write this world-changing paper that gets published in a big journal. So I think for us as academics, for those of us in positions of leadership, it's figuring out ways that we can reward that community engagement while also respecting the need for new science. And set up systems to support community engagement without us having to be there. But I mean, again, how I started, I'll finish, which is yes, we have failed. Unfortunately, there's little bright spots.
Okay, last question. Yes.
I'm a graduate student from political science department, and I want to ask because we, as a scientist, we are more closer to the government, I think.
Yes.
How to communicate with government, because in the pandemic there are many like failure in the communication between the scientists and the government, and which sometimes they ignore our evidence, scientific evidence.
Yes, they do.
How to efficiently communicate with the government, and when do they adopt our like suggestions?
I love that question. And I think part of it is having political scientists work with population scientists and public health scientists. To me, that's where it starts. I think part of it is learning how to, it's the same thing of how do you communicate in language that makes sense? So learning how to write a policy brief or how to bring in constituents who the politicians will listen to, learning what language works for them, who the trusted or influential messengers are for them. That's step one. And I think, you know, I have this discussion a lot with my own school. We spend a lot of time teaching the science. We don't spend as much time teaching the communication, not just with the community, but also with politicians and legislators. I think it's an essential skill for us to impart, particularly for master's students. If you're a PhD student, maybe you're going to be spending more time, or a postdoc, you'll be spending more time in the laboratory than in politics. But for our master's students, most likely you're going to be out and taking action. And so learning that way of communicating is really important. And it's across the globe, we don't do a good job of doing that. I think the second thing is, you know, so learning the language, kind of working with the trusted voices, but it's also kind of learning what matters to the politician. And also understanding that sometimes they are balancing realities that we don't see all of. You know, to me, the most important thing is protecting health. To them, their most important thing might be protecting the economy or responding to a special interest group that's funding them for their reelection, right? And that's a cynical view, but there may be other things that matter deeply to them. And so taking the time to understand what their most important driver is, what their, you know, maybe it's costs and the fact that they're worried about a ballooning deficit. They don't want to have to increase taxes. So understanding what those concerns are for them then helps us to couch our language and our suggestions in ways that facilitate progress. That's a great question.
Thank you. Now we do have to come to the end, but I do have to ask this question, I mean, for our young scientists, right? I mean, now you are such an accomplished researchers. Any advice, I mean, to our young colleagues, especially for the females one, for the women, I mean, any good suggestion to them?
For the women and for the men, I'll say actually for both, if you decide to have a partner, find a good one who will support you in doing science.
That is hard.
It is hard. It took me many years of training my husband to get him to. But he ended up being a good one in the end. So, but I would say but also, I mean, the other thing is to keep going. I think science is very difficult and it can be very frustrating. It's full of a lot of rejection and failure, whether it's getting your papers rejected or applying for a grant or doing an experiment and not finding the results that you were hoping for. That's part of the scientific journey. And so to not take it as a reflection on yourself, I think is the second thing, that it is not a statement on your own worth or value or on the importance of the work that you're doing. It's just part of the process. And every one of us, including your dean, probably, we haven't talked, but like, and certainly including me and probably, we've all been through it. And so to kind of keep your own sense of self despite those failures. I think the last thing would be to think about ways that you can translate your science into something that makes the world better. To me, that's the mark of a career well lived. You may not be able to do it in these first years of your career, but by the end, you want to look back and know that what you have done, the science that you have done, has not just been published in a great journal. It's not just that you've made professor or, whatever your goal is, but it's also that you've made the world healthier in some way. And so I would say to have that North Star for your work can keep you going even in those difficult moments.
Well, I think it's a wonderful rung up. I think, do you have this working manual, how to make your partners better? Anyway, I think
I'll do a side business of it. Yeah, I have lots of tips on men I dated who were not good partners also. So that's a different discussion, but yeah.
You should send an email. I mean, and I keep the thing. Well, it's very enjoyable to talking to you. And then I hope this sort of fireside chat, although we do not have a fireside here, but I think we do like to promote this sort of communication, understanding between US and Hong Kong and Yale and Hong Kong U. I think we hope this sort of conversation can continue. I mean, despite all this geopolitics, and also our student can go to visit you, and you're more than welcome, I think, to come back again. I think.
Thank you. I hope to come back soon. I was saying this is my first time in Hong Kong. And I am just so overjoyed to be here. It has been a true pleasure and a privilege. I'm so happy for really honored for the invitation to come here today. So thank you very much.
And also, actually, I think Ranney bring Ben along as well. Ben is a very important person. And then he's the one who helped us to establish this connect with Ranney. So thank you, Ben. Okay.
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 Thank you.
See you next time.
Okay. Thank you.